So when you think of depression, you might think about sadness, fatigue, or a loss of motivation. But for many people, one of the most noticeable changes happens in their sex life. A sudden drop in sexual desire, sometimes so strong that intimacy feels like it's just not possible. I'm Dr. Anand Chaturvedi, psychiatrist and clinical researcher, and today we're going to explore why depression can lower libido, what's happening in the brain and body, and what you can do about it. So what do we mean by libido? Libido is simply your sexual drive, your interest in sexual activity. It's shaped by brain chemistry, hormones, mood, and relationship dynamics. So when depression is present, all of these areas can shift, leading to noticeable changes in sexual desire. Now, what's happening in the brain? Depression changes how certain brain chemicals work, especially dopamine, serotonin, and norepinephrine. So dopamine drives motivation and pleasure, and low dopamine levels make it harder to feel excitement, including sexual excitement. So serotonin regulates mood, but too much can actually suppress sexual desire. And norepinephrine supports alertness and arousal. And when it's low, your body may feel less ready for sexual activity. Brain imaging studies show reduced activity in areas like the reward system and the hypothalamus, which helps process sexual cues. So in short, the brain's green light for sexual interest isn't as bright. Now, you have the emotional layer, and what I mean by that is depression brings emotional changes that can make intimacy difficult. For example, loss of interest in pleasurable activities, reduced self-confidence or self-image, and mental fatigue, making the idea of initiating or engaging in intimacy feel overwhelming. So even when the attraction is still there, the depression can make pleasure feel distant. And there's the physical side to this. Depression affects the body in ways that directly influence libido. Low energy, constant fatigue, sleep problems, either too much or too little, appetite, weight changes that affect body image, and hormonal regulation. Now, hormonal shifts from chronic stress make it difficult to get aroused. The medication factors, there's a lot of antidepressants, especially SSRI drugs like sertraline or fluoxetine, that are effective for mood, but they can reduce sexual desire or make arousal and orgasm more difficult. Now, this happens because higher serotonin levels can dampen dopamine activity. Now, the upside or the good news is there's treatment options that exist. You adjust the dose of the medication or switch to a medication like bupropion, which tends to have fewer sexual side effects. Or you combine medication strategically, meaning use an SSRI with bupropion, and the bupropion will counteract the effects of the SSRIs. But any changes should be made in consultation with your prescribing clinician. Now, a change in libido can affect relationship dynamics. Your partner may feel rejected or unsure of what's happening. There could be a misunderstanding, which can increase stress, which further reduces your sexual desire. So you got to talk openly with your partner about what's going on and what can help remove that uncertainty. If depression is affecting your libido, here are the steps that can help. Number one, you got to treat the depression, whether it's therapy, medication, lifestyle changes. All these things can lead to a natural return in your sexual desire. Number two, support physical health. Better sleep, nutrition, exercise, all these things boost mood and sexual vitality. Number three, reduce the pressure around intimacy. What I mean is start by touch and closeness without the goal of intercourse or orgasm. Number four is try mindfulness. Focus on practices that help you reconnect with your physical sensations without the performance pressure. So when do you seek help? If the libido changes have lasted weeks or months and are affecting your quality of life or relationships, it's time to speak with a professional. A psychiatrist can help determine whether the cause is depression itself, a side effect of medication, or a combination of factors. So the takeaway is depression can definitely lower your libido through changes in brain chemistry, emotional state, physical health, and medication side effects. All these factors are treatable, and with the right approach, sexual desire can often be restored. Now, if you found this video helpful, subscribe for more insights on mental health, relationships, and sexual wellness. Take care of your mind, take care of your whole self. I'll see you on the next video.